I have the 3 dick moves that you get when you go see a doctor about mast cell or histamine intolerance. You heard me right, dick moves. I look at the way that we look at mast cell right now because it is complex and the symptoms can be so varied. I have the 3 dick moves that you get when you go see a doctor about mast cell or histamine intolerance. You heard me right, dick moves. So what are the 3 Ds? Number 1, they deny. They deny that mast cell or histamine intolerance or these type of allergic reactions exist. Deny. How many of you guys been denied? You go in the office and they tell you it's not real, it's not happening, right? It's in your head. Deny, right? Number 2 is then they dismiss. They may know what mast cell is, but they dismiss. They dismiss your symptoms as it's not bad enough. It's not really that. How could your blood pressure be related? How could it cause palpitations? How could you have insomnia or anxiety? Dismiss your symptoms as being in your head or not real. So they can deny that mast cell is real. Number 2, they dismiss your symptoms. And then number 3 is they delay. What happens is when you deny and you dismiss, you're actually delaying the diagnosis, right? Or any sort of exploration in it or treatment of options of this. And oftentimes, because of the 3 Ds, what you'll find is people get no help, or number 2, they get delayed treatment and diagnosis by being sent to a million specialists that really have not much to offer, and it takes forever to get to them, and they don't talk to each other.
Yeah, and I just want to say that that's exactly medical gaslighting. And that's, I mean, it happens and people feel it. That's the frustration that I think, the groundswell of frustration and people being pissed about this. I mean, that's where it's coming from.
And the consequences can be serious. You know, we're seeing our friend Stacy, an alumni, say she thinks that all of this may have contributed to a heart attack for her.
Yeah.
Others are saying, you know, they feel they've been gaslit and just told it was anxiety, like this comment here. And yet the consequences of denying it, delaying it, can be very serious.
I just wanted to go back to that last comment, and I'm just going to say something. It's one of my favorite quotes. It's a Kathyism. I always say it. You probably heard me say it 100 times. But just because something is common doesn't mean it's normal. So all these docs telling you, oh, this is normal. This is normal. What they should be saying, and what you can respond to them is, no, it's common. It's not normal, right? There's a big, big difference. And too often those two things get lumped together as the same thing, and then nothing gets done.
Hi, I'm Maggie Yu, MD, and I'm a functional and holistic medicine physician and the creator of the Transform and Transform protocol. If you're interested in learning what are the root causes of all chronic disease, go ahead and click the link in the description where I have a power pack 30-minute training that goes over what are the 5 pillars of Transform. Go ahead, click the link, and I'll see you in that training. Is it common? That's the question I have for you guys. I know the answer to this because Dr. J, you brought this up in one of the Facebook comment threads. You said a lot of people perceive mast cell, a lot of doctors think mast cell and histamine reactions are rare. Is it rare? And I'm going to ask the audience this. You guys think it's rare or you think it's common? Everybody jump in and vote right now. Put rare or common in chat right now.
A lot of people saying common.
Yeah.
Common. So
yeah, and yet we're told. I mean, we're, like I said, if you do have a discussion about it, if you happen to Google it, mast cell activation syndrome as an example, they say it's a rare condition. You know, and yet so many people seem to be suffering from so many symptoms that are directly related.
I see hundreds of comments coming up right now.
Right?
It just shows you the scope of this problem.
Just because it's common doesn't mean it's normal. And it is common. Don't let anyone tell you otherwise. I'm going to tell you right now, I am pissed and livid every time I hear someone tell me that their medical provider told them that mast cell activation and POTS or histamine intolerance are not real diseases. And in fact, and there was a quote, and I want you to give the person credit for it, where a functional medicine provider, and then this is a direct quote of what they said to this person. Amy S. says, I have a functional doctor tell me that all my histamine issues are caused by depression. And then she had a nurse practitioner tell her that food and stool testing are useless tests and that she instead should be treated for mental health disorders.
To have a functional medicine provider, though, tell you that this is all because of depression, this is not real. The root cause is anxiety. The root cause is mental health.
Can I show you this graph again? The arrow goes from the mast cell to the central nervous system. not the other way around. Not because someone has a central nervous system issue with anxiety, depression, does it cause histamines to release. It's the other way around, people and doctors. Pay attention to science.
Yeah, very frustrating. And we've been having people really echoing that in the comments on our live here today as well, saying, I cannot stand that I'm just being told this is anxiety and that's it, because the consequences can be great.
I have this perception, having worked with, lots of different people, a lot of doctors have this idea that they know everything. I mean, they've seen it all, they've done it all, they know everything. And so if they can't figure it out, and all these specialists can't figure it out, then it's not on them because they know everything. It must be in the patient's head. So therefore, it must be a psychiatric condition, because otherwise brilliant me would have figured it out. And I mean that out of due respect, but that's just the thought process that's out there.
Well, and from personal experience, as a primary care doctor, the first 10 years of my career, I shudder, and I'm very ashamed of the fact that how many patients I put on antidepressants, or sent them to go get some therapy or something, because I couldn't find out with my neuro testing that I was trained to do what was wrong. So, it's another, 40-year-old fatigued woman who's complaining about allergic reactions or this or that. I mean, you in the back room in the doctor's lounge, I'm telling you right now, they are holding their heads like this all day long, rolling their eyes at the 10th patient of the day that walks in like this. It's that common. And yet we as primary care providers have a very limited array of testing and options that we have for dealing with these. Hi, and thank you for watching this video. If you're interested in actively looking for a solution to your problem and you'd like to work with us, I'm going to invite you to go ahead and click the link in the description to book a chat with our team. I and my team look forward to talking to you to learn more about you, to see if we are indeed a good fit to work together. Thank you.